I can hear it. We were listening to Forever Your Girl by Paula Abdul.
There
So,
you go.
but that's weird. You can't hear it. You can literally just hear me talking, but not the music.
Yeah, you could probably
Correct.
connect it to Zoom. Do you know how to do that?
No. Hi,
Girl,
everybody. We're just figuring this out. Welcome.
we got this.
Welcome. We are so excited to be hosting the very first Wake Her Up group consultation. So welcome in. We have so many questions that have been submitted, and we're going to start off by going through some of those that have been previously asked, getting through some of those. Make sure you take good notes. And this is being recorded. So if you have registered, we are going to edit it nicely so that you can have this, and we will send out the replay if you're missing anything. But super excited to have everyone here. We're gonna give it just another 2 minutes. We were dancing, but apparently I can't hear my music. So next time we'll have music, or you just go ahead and play your own music and dance around. That's fine. I'm really bummed that you can't hear my Paula Abdul, but it's okay. It's okay. Get
You
there.
can hear your music. That's all that matters.
Right? I hear my own music. It's like a silent disco. It's fine. Okay, speaking of Paul Abdul, I had friends come out to Utah this last summer and hang out with me. We went to Janet Jackson. Suzanne was there. Suzanne and Katie was there. Was so good. And we'll have to just do it again next summer, right? We'll find some cool, fun 90s band, and you guys will come out and hang out with me and we'll dance our asses off. So welcome. Good morning, everybody. Hello, hello.
Good morning.
So excited everyone's here. We had over 100 women register for this event. It's our very first event like this, where we're doing a group consultation. Now, a couple of reasons why we're doing this is because there's so many women running out and getting hormone therapy, and it's really hard for everyone to be getting their questions answered as quickly as they want to from any provider because all of them are busy. Every one of them is like, even my local provider here is like, can barely keep up. I mean, it's just like expanding everywhere. I mean, we have how many billions of women that are in perimenopause right now, just finding out like, oh, this help exists. So it's likely that no matter what type of hormone therapy you're receiving, it is hard for you to get some quick answers. And so Joy Women's Wellness, to see Katie, the founder of Joy Women's Wellness. I like don't know where to point because I don't know where you are on your screen, but Katie Wallen is the founder of Joy Women's Wellness, and she agreed to bring on her doctor, one of her doctors, providers, Melissa Loseke, and we are teaming up to answer your questions in like a big, huge format so that you don't have to book an appointment, you don't have to pay for it, you can get your questions answered. But also, if you haven't even started hormone therapy, this is such a great place to sit and watch what questions are being asked by people that are in hormone therapy so that you can go ask these questions to your own provider, and you can kind of save yourself some time and some money, and it's kind of the whole point of Wake Her Up anyway. So super excited to have everybody here. Hello, hello. Okay, I'm gonna ask, I know you're gonna see my face all the time. I want to see yours, or what's the point of Zoom? Like, I'm gonna kind of be the teacher that's like, please turn on your camera. You're not wearing a bra? Fine. You didn't do your hair? I don't care. You guys have seen me at like the worst moments on TikTok. And of course, the ones that I don't do any makeup go like millions of views. The ones that I do get dressed up, nobody cares. So if I get to be on TikTok with a million people looking at me with no makeup, you can be right here. I want to see your face. That's why we did this on Zoom. Otherwise, we would have just done a regular thing and just sent it to you. Yes. Hi. Hello. Hi, Jen Brown. Hi, Lynn Black. Hi, Claire, Donna, Alicia, Shane Scott. I'm assuming that's probably not your name. I'm just guessing because mine always shows up as my husband's and I have to change it. Hi, Cindy, Susan, Jilly. Good morning, everybody. I see your happy faces. It's so fun to see actual real people. Do you guys know that I basically just talk at my phone and then that's it? I don't know that you're actually real. So this is beautiful to see you. Thank you so, so, so much for being here. Okay, we're giving this one more minute and we are jumping in. We just want to let everyone get in here. I would love, do you guys know how to use it? If you know how to use a chat feature, that's kind of fun. I'd love to see like where you're from. If everyone wants to just drop like, I'm like where you're from, we'd love to see like how big of a range we have here. Hello, Nashville, New York City. Okay, if you're gonna be in New York City, I'm gonna be there in about a week and a half, and you should come hang out with me at the Kelly Casperson book launch. If you need more information on that, it's in the Facebook group. Now, in the chat, we are going to drop a couple of links. So anything that we're referencing here, you're going to be able to find there. Riley, could you first drop the link to the Facebook group? Awesome. Now, some of you guys don't know me, so I'm going to go ahead and start by introducing myself. You're like, who is this girl yelling at us? It's Marcella Hill. Here I am. I do yell a lot at my phone, and the computer is no different. So here you go. So I'm Marcella Hill. I am the founder of Wake Her Up. Wake Her Up has accidentally become the world's largest global directory of hormone therapy providers that have been recommended by women. So wakeherup.co is where you'll find the directory. And you'll also find a global community of over 48,000. We just hit 48,100 women. 48,000 women are all hanging out in a free Facebook community. And that's the link that Riley just dropped where you can go and join that. And this is a community that happened, again, accidentally. I told my story on TikTok about hormone therapy and perimenopause. The next day, 9 million views. And everyone's like, where are we going? Where do we go? How do we get the help we need? I feel crappy too. Let's hang out. So we started Wake Her Up because that's the name of my book that I wrote. And I did not mean for any of this to happen. Here we all are. So wakeherup.co and Wake Her Up Free Community is where I'm coming from. I'm an author, advocate for perimenopause, and I'm just thrilled to be here. I am one of you. I am just one of the girls trying to figure out why the hell we didn't know about this. Where are we going? What are we doing? And why were we not informed? So that's who I am. And I'm so excited to turn this over to Dr. Melissa Loseke. She is a doctor. She's going to tell you about her practice. She has been practicing for years and years in many different methods. And that's why Melissa is such a perfect fit for this conversation, because she does pellets, she does injections, she does creams, she is on the board for Joy Women's Wellness. And so she's able to speak to all of the methods, and her approach is so beautiful. I just love finding doctors where I'm like, I would want to send my grandma and my mom and all of my best friends to her. So Melissa, I'm turning it over to you. Go ahead and introduce yourself and welcome.
Hi, ladies. Dr. Melissa Loseke, based in Omaha, Nebraska. I saw a couple Minnesotas, Iowa, so some people who are kind of close into my proximity. So good to see all your beautiful faces. Just like Marcella said, I am a medical advisor for Joy Women's Wellness. I also finally bit the bullet and went into my own personal private practice about 4 years ago, just because I felt like outside of Joy, nobody else does it great. I mean, you guys have probably all had the experiences where you go into a pellet only place, or you go into an injection only place, or you go to somebody else who only wants to give you creams without giving you the full options. So that was a little bit about my journey. I have been in this space for, I hate to admit it, more than a decade. It makes me feel really old, but whatever. So I kind of joke I'm one of the OGs in this space. But before we kind of dive into your questions, I want to give you guys a little bit about myself. So I believe in transparency. I am a patient. I am a perimenopausal female. I'm 44. I've had a partial hysterectomy. Causation, correlation doesn't matter. After I got 2 vaccinations in 2021, within 3 months, I was basically what I would say menopausal. Anybody would look at my labs and say, your estrogen levels are great. My vagina felt like the Sahara Desert. You could have dipped my skin in a vat of Vaseline. The hair was just kind of dry and brittle. I was sweating through sheets like crazy. I had already been on testosterone. So I have been on testosterone now for almost 6 years. And this will be my just past my third anniversary of a little bit of estrogen for myself. I would fight you tooth and nail before I gave up either of those without question. I'm a better human being. I'm a better mother. I'm a better wife. I'm a better everything because of my hormone replacement. So I always like you guys to know a little bit of my story too. I'm not just somebody here who's sitting here spewing facts to you. I'm in the same boat that you guys have been. And just like I said, had I taken my labs someplace else, I would have been told I don't need any estrogen. I have tried to give it up a couple times. I regret that decision every single time. I will be one of those who takes it to her grave. So
I just love you. I love you. I love that you are the kind of person that just feels like you're in this mix with us and also providing the solution. It's so good.
Right.
I want to just introduce Katie really quick because you're here. Katie, do you mind just saying hello?
Let me first of all put on my glasses because I don't know if anyone else has done this, but like I cannot see anymore. My eyes started going like a year ago, and I believe that's also perimenopause. I am 45 and I started Joy because I just want women to feel better. I had a lot of trouble myself having babies and had my last one at 42. And I felt like I went right from trauma right into perimenopause, and hormones saved me. So that is why we are here. And just thank you so much for joining. And thank you, Melissa and Marcella, for sharing your voices and your stories.
Always.
So much, Katie. Okay, we're gonna just jump right in. I want to. This whole Zoom has been put together for all of you to answer these questions. So if you're needing to find a hormone therapist, you already know you can go to wakeherup.co. We'll also be dropping a direct link to be able to book a consult or get your blood work done with Joy. But this is going to literally focus on answering your questions, and it should feel like you're in your doctor's office. Well, it shouldn't feel like that, actually. It should feel like a whole new realm of sitting in your doctor's office, actually being listened to, actually being able to ask any questions without the shame, without someone being like, oh, you're fine. So that's what we're developing here, is what we actually want when we ask questions to a doctor. So
this is like wine with girlfriends at 11 a.m.
Right? Yeah. I should have brought the wine, dang it.
Right.
Next time. So to very first, like, high level, I want to say this because I feel like this helps give some understanding on a very high level of perimenopause. I want to establish in your minds that perimenopause is a phase of life. This is not a diagnosis. It is like puberty. If you are between the ages of, let's say, 10 and 20, let's say your 10-year-old hasn't started her period yet, would you all agree that they are in puberty? Anybody? Yes, this will like raise a hands, right? A 10-year-old is definitely in puberty, might not have started her period, but she is all kinds of hormonal, right? So I want you to keep that concept, because when we're talking about perimenopause and you're talking to your friends about it, and you're talking to your 40-year-old friend and she's like, I'm not sure if I'm in perimenopause, I want you to be like, yes, you are. Yes. This is like puberty. There's not a blood work for puberty, just like there's not blood work that determines perimenopause. So I want to establish that as just like shifting perspective for all of us when we're talking about this with our friends. Everyone good? It's a phase. It's a phase of life. Okay.
It literally, from a medical perspective,
Yes.
It literally means around menopause. It's like telling your girlfriends, I'll be there about 11 o'clock. I might be 10 minutes early. I might be 20 minutes late.
Yes. Around menopause. That time
means
around
menopause.
Perfect. Okay, we're going to jump in. I'm just going to go through some of these questions, and then we're going to get to if some of these questions that people have put in aren't your questions, we're going to get to you. You're going to be able to voice this and be here with us. So one of the big things is the weight gain. Raise your hand if you're like, what is happening in my belly? Why is this extra tire here all of a sudden? Why is the fat like redistributing in different places? So let's talk about weight gain. The very specific question is from Sarah Sparks. Why do I have a pooch? What is going on? I feel like I'm sloshing around water weight and it feels like it increases. Why is that happening?
Okay, so I'm just gonna clarify. We're talking just perimenopausal gals, not postmenopausal.
Right. Yep.
Okay. Because the reason for that distinction, ladies, is so estrogen plays a role in how you metabolize glucose, insulin, cholesterol, what your lipids look like on a very high surface level. So as a postmenopausal gal, when your estrogen levels start fluctuating, you'll get the midsection weight gain because your body knows, your brain is smart enough to know, hey, my estrogen is gone. My ovaries are sipping cocktails on the beach. They're done. They're retired. And so it starts to store that estrogen. Where does it store it? In fat cells. Fat cells typically tend to be a great place to store estrogen. So it's why most postmenopausal gals will see that in that midsection hip range as well. Well, to back it up, it gets a little bit more complicated for us perimenopausal gals. So now I have to go, okay, well, is this because your testosterone levels are fluctuating? Is it because your estrogen levels are fluctuating? Is it because progesterone has start to fail? So the why becomes a little bit more difficult to figure out. That's where, and I know everybody says there's no lab to diagnose perimenopause, but that doesn't mean that there's not a lab to figure out, are there shifts that could be addressed with hormones? The other thing I love to tell gals, welcome to perimenopause. Guess what? Your body doesn't love carbs like it used to. However, with those fluctuating insulin levels, your body is saying, I'll take the cake for breakfast and I'll have a side of a baguette and a bagel with it too, please. It is a horrific combination. So most of us gals, as we get closer to menopause, we need to shift away from our starchy carbs. Doesn't mean a vegetable is bad. It doesn't mean an apple's bad, but that bagel and those sweets that we crave, our body doesn't do well. And all it's doing is throwing fire or gasoline on the fire for that midsection weight gain. The other thing I will tell you is if you are a CrossFitter, you love Orange Theory, you guys can kind of, those of you know yourself, high intensity does not become your friend. Welcome to zone 2 and pick up some weights. All you're doing from that perspective, and my CrossFitters who love CrossFit, they're Orange Theory gals, they're working out. And my favorite is most of the time, by the time as a practitioner, a gal gets to me, she's been a minimum of 2 to 3 other places, talked to other physicians, other providers, and hasn't gotten the answers that she's necessarily looking for. I love the one where the gal goes into a provider, she's put on 10 pounds, she's working out 6 days a week for an hour, maybe 7, and eating 1,200 calories. And the response is, eat less, do more. Because we're all pulling out our book going, where do I carve out another hour in the day to work out more? I'm already only eating 1,200 calories. It doesn't become the answer. You still have to fuel your body and finding the right type of exercise for your body in this age group. And the other thing I'm going to tell you is don't be afraid to ask for help. I mean that in a medical sense. I mean that in an exercise sense. Like, don't be afraid to reach out to somebody. I was that gal. 2022 hit. Now the question for me always becomes, well, is it because I finally got balanced from an estrogen standpoint? Is it because I quit doing HIIT 3 days a week? But I had a 10 to 15 pound weight gain that had just crept up. I was uncomfortable in my own skin. Now my clothes all fit. It wasn't terrible. Most people would be like, you look great, Melissa. And I'm like, yeah, but I don't feel like the me I want to be. I don't feel like the me who's comfortable in her own skin. And so I picked up the weights that I hated to do. I cut back on the exercise and surprisingly started feeling better. My caveat there is going to be, and I'm always a full disclosure gal, I also leaned on the help of a little bit of GLP-1. So the semaglutide, the Ozempic, the Wegovys, and did great. Lost the 10 pounds, felt better in my own skin, and have been able to maintain that weight now because I got the little bit of help and push I needed. So that's a super long-winded answer to, there's a lot going on, but you've also got to look at you and say, okay, well, am I trying to overdo it too much? Am I in need of estrogen? Do I need a little testosterone? And I don't know. I know, Marcella, you're very open about your journey and what you're on. One of my first signs that I'm due for, I do pellet therapy. One of my first signs that I'm due for a pellet is all of a sudden my midsection pooch is back. I can tell that my cravings are back. And I'm like, I should probably get those labs checked. Sure enough, I'll find that things are off and I'm due. So balance becomes important. And I say balance in a very big way in life.
I love that. Thank you so much for that. Now, I'm always just like the other person that adds to this,
I love it.
But I always want to say the big thing here when we're talking about weight, we want to feel good in our body. That's probably the number one thing, right?
Correct.
And
Yep.
one of the phrases I've learned, couple phrases. One, right size body for me. Write that down. Get the right sized body for you, right?
Yep.
Not for her, not her right size body, right size body for you. And the other thing that really alters I use this every day at some point during the day. And you need to repeat this to yourself. I am not my body. I am not my body. And you can use this for so many things. And the reason why this phrase is so important, because as we're going through this phase, your body is going to grow and shrink your whole life. Isn't that neat that our bodies can even do that? And I think what we're really aiming for in weight loss is a place to like ourselves, a place to love who we are, a place that we can show up to a party and feel like, here I am. And we've decided that that comes with a specific weight. But once you realize you are not your body, then you can show up at the party for all of you are at any weight. And so I want to say that just to save you from the running yourself into the ground, thinking you can't show up today because your pants are too tight. Yes, you can. You're the same you with tight pants or loose pants. It's the same you. And I think that when you start getting out of your own way, that's when your body ends up starting to be the right size body for you, when you start showing up for yourself. And so I always want to like add that on because I think all of us have had the weight loss conversation, right? We've cut out the carbs, we've done all of these things. But the thing that we haven't done is accepted and fallen in love the fact that our bodies grow and shrink, and isn't that neat? And how do we show up, whether they're big or small? So that's my take on the weight loss thing. I want to take some questions from the women that are right here because I want to hear your voice. At the bottom of your screen, you should see a button that says reactions. And when you click on reactions, then there's a button that has a bunch of emojis, but it also has a bar that says raise hand. If you have a question, can you please go push that button? And that will tell us that you have a question. And then we're going to call on you. And then you're going to need to unmute and ask your question. Everyone good? Okay, so who has a question? Go and click raise your hand and join into this. Nobody has any questions, apparently. Come on. Let's see. I'm like looking. Unless I'm looking in the wrong place, but Riley, do you see
we've got a couple.
raised?
We've got a couple now.
Okay. Yay, there you are. It was just a little delay. Okay. Miss Scott, we're gonna call on you. Hello.
Hi, I would love any tips for dealing with the memory and brain fog while I'm waiting for the hormones to help me out. I just started hormone replacement therapy, literally my first estrogen patch yesterday. So
Awesome.
while my brain is scrambled, I would love any tips that people have for dealing with the brain fog and memory lapses.
Okay. One of my favorite, testosterone. So I love the estrogen. I love the progesterone. If you're a postmenopausal gal, if you're a postmenopausal gal on estrogen and you have a uterus, you have to have progesterone. No ifs, ands, or buts about it. If somebody offers you something else, walk out the door and go find somebody else, please. Testosterone, super fantastic from the brain fog standpoint. It does fabulous things for the body. But from an over-the-counter standpoint, DHEA is a precursor to testosterone. Love some DHEA. It's at least to get things started. Outside of that, I'm going to talk about simple things. Protein, getting plenty of sleep, not overdoing it from a caffeine standpoint, not overdoing it from an alcohol standpoint. Vitamin D, go get outside, soak it up, go for a walk, decompress in any way, shape that you can. Protein is a really big one for me. So we'll talk about the hormone hierarchy a lot of times with my patients, where it's this triangle. And what most people don't realize is that, yes, we talk about estrogen, progesterone, testosterone as hormones, but they're really the top of that pyramid, meaning they're not the base. The base becomes your DHEA, your cortisol, your insulin. And those are the things that you can shift by what you eat, when you eat, how you eat, what you're not eating enough of, hydration, things like that. I cannot tell you how many gals under fuel from a protein standpoint. And I also love to tell you no protein or no caffeine without protein first. So caffeine stimulates cortisol, which is your stress hormone. Cortisol is what I call the great masquerader: midsection weight gain, brain fog, hair growth, acne, moody, crabby, irritable, crappy sleep, cravings, like you name it, it is going to look like a lot of different things. When I tell gals from a protein standpoint, I want you at a minimum of 100 grams a day. Most gals look at me and they're like, ooh, really? I'm like, uh-huh. It seems like a lot, but start somewhere. So if you're a 30 gram of proteiner a day, say, okay, for the next week, I'm going to try for 40. Your purists out there are going to tell you gals, hey, I don't want you drinking it. I'm a realist. I've got 3 children. There is no time for me to eat 100 grams of protein a day. So if that means I'm taking a Fairlife protein that drinks like chocolate milk, but has 30 grams of protein in it on my way to work, fantastic. But the brain fog is real. I mean, without question, I would tell you those are things I would focus on. Get outdoors or start a vitamin D supplement, which is going to help the energy as well. Focus on increasing up that protein, making sure you're getting plenty of sleep, plenty of water. Have a conversation with your provider about testosterone. Do you need it? What do your levels look like? And in that interim, if you want to try a little bit of DHEA, I'll usually recommend my gals to start somewhere between 5 and 25 milligrams.
Awesome. 2 things I want to add to that and also get your opinion. I know that Joy has a supplement called
The
Focus.
smart supplements.
Uh-huh.
Yes.
And well, also like the other, it's like Focus, right? It's like a separate thing. Yeah.
Correct. Yep.
But that contains lion's mane and I believe reishi, anyway, functional mushrooms. And I have drastically increased my lion's mane intake. I have dementia in my family. My grandma currently has dementia. It freaks me out. So I'm like, I'll give me all the lion's mane I possibly can take in. And I think combined with that, and then also the terzepatide, I don't know if this is medically like thing, but when I am on my terzepatide, I feel like that is when I am the clearest. And maybe it's just because the food noise isn't there, but that is when I feel like I can think straight. I can recall things. I will surprise myself by remembering like someone's name or be able to just remember a phone number or a PIN code. I'll be like, something's working, right?
Yep.
But I don't know. Is the terzepatide something that helps with brain fog?
So there's a ton of studies going on right now with terzepatide from everything from PCOS, IBD, IBS, chronic inflammation, some of the autoimmune disorders. We're also seeing some studies coming out from an Alzheimer's perspective. So this is that whole gut-brain connection. If insulin is high, which is what terzepatide is targeting, inflammation is going to be high. So when gals start on a low dose of terzepatide, a lot of times they'll find, oh, my joint pain is gone. Ooh, I'm sleeping better. Like we're quickly seeing it as a potential for a longevity medicine. I told you guys I was on it. I've been able to maintain weight. I actually this year started a low dose, not from a weight loss perspective, but from a longevity perspective. Because what you're also doing from that brain fog perspective, like as Marcella is talking about, is you're decreasing inflammation in the brain. which is why we're seeing improvements in depression, anxiety, Alzheimer's, and at a simple level, oh my God, I can remember somebody's name. I haven't forgotten to pick up my kids anywhere. Just I can get through my day more clear because that inflammation that's everywhere in the body is gone.
That's awesome. That's so good. I love getting the actual information because when we're, marketed online to all these things, we just get these like buzzwords and, you think it's just a weight loss drug when it's helping with dementia. And I think what's interesting about this
Correct.
whole conversation is we're talking about simple things that a lot of us have been told, like lower your carbs.
Correct.
Talk about it in the context of like, this is going to help you remember your kids' names. Like that's when women are like, oh, I will lower my carbs for
Okay.
not to like fit
Right.
into the social norm of the body that the men think we should fit in, but like to remember my kids' names, worth it, right? To skip the donut.
Right.
I think it's just interesting because it's like the same thing. We just were sold it the wrong way.
Correct. And ladies, here's what I'm going to tell you. If you want the piece of cake, have it. Life is too short. If you want the donut, have it. What you're going to hear me say is have a protein shake before you eat it to help lower that insulin response in the body. Have a cup of yogurt, have some cottage cheese, and then say, you know what? I'm going into that cake.
I love it. And, Wake Her Up is all about like listening to yourself and loving yourself.
Right.
And you're the only one that knows if you honestly need to have the cupcake to be able to tell her, like, we get to have cupcakes and we're okay. Or if you're totally abandoning yourself and eating a cupcake because you're like trying to numb out. Like, those are two different things. Right. So you have to be honest with yourself. That's the whole point of awakening her so that she can speak to you from the inside and like tell you if you should actually have the cupcake or not. So, okay, let's jump to the next question. We have Jilly. Jilly, are you ready? Jump in.
Thank you. Yeah, I'm postmenopausal. I'll just give you I started HRT last year, so it's been over a year. I'm on the patch and I'm slowly moving up. I can't think right now what my markers are, but I'm on
dosages.
Yeah, for my blood draw. I have my blood draw. I don't know it off the top of my head right now. I know I'm going to need to use my patch. I don't believe my patch is actually really 100% working as well as it can work for another person. I don't know if my body's absorbing it enough. So I'm kind of waiting that. I'm on 0.05 and I'll see if I'll go up 2 more, but I'll talk to my doctor about that. My question is though, the bloat. Now there's weight gain, but like, I just keep thinking I can't get this bloat. So I don't even know some days if is it bloat, is it weight gain? I've been increasing my fiber. I'm on point with everything, like getting the 100 grams plus protein. I use a chronometer, which that really helps me manage understanding my protein. But I think this bloat is what is, that's been really life-changing. Like,
so one of my first questions is, are you on progesterone?
I am. Oh, for sure. Yeah.
So sometimes progesterone can cause bloating. So progesterone is our PMS hormone. So a lot of times that conversation then that has to be had with the practitioner is, well, let's say you're on 200 milligrams of progesterone. 100 milligrams is the minimum that a postmenopausal gal is required to be on. So sometimes too much can cause the same symptoms as too little. Yes, on a rare occasion, we'll see some gals who maybe that form of estrogen isn't great for you and you're seeing some weight gain. But the easy kind of walk around here first is, again, if it were me, what I'm going to start playing with is the progesterone. Do we need to go up? Do we need to go down? Because when progesterone is balanced, it should be a natural.
Okay, I'm on 100 milligrams of progesterone. So
it's maybe that's one of those conversations with a practitioner of maybe I need to try 200. Maybe 200 flushes out that bloat a little bit better.
That's good.
The other thing I'll talk about with gals is, we've got creams, orals, troches, rapid dissolves. I've had gals who do great on a capsule, but man, a rapid dissolve tablet bloats them like crazy, or vice versa. So I'll also tell gals, play around with the form of progesterone that we're using, because maybe one is going to be better than another.
Okay.
That was
And the
actually
other-
my case. I was on like a pill form and I was
Mhm.
bloating. It actually made me feel very drunk. And I was like, it felt weird. And I was waking up almost like hungover. And I went to a troche and halved my dose, and it feels exactly right for me. So it is fun to play around with too. Like just kind of listen to your body, and it's fun to like connect with your own body and be like, okay, what did that feel like? You know, and like,
Yep.
oh, maybe a little up. Oh, nope, a little down. Like just know like you can play with it.
No, that is good to know. I didn't know you could play with it really. Like, so yeah, I'm going onto your Facebook. I've noticed like, I've learned so much. I'm just a recent, added person to your Facebook.
Awesome.
Yeah, seeing people going on 400 milligrams of progesterone. You said the progesterone, I never even thought, and that's been coming up that it could be contributing to bloat. So that's been really helpful.
The other thing I'll tell my postmenopausal gals is, now don't hold me to this. Don't put me in front of the firing squad if it doesn't happen. But in a postmenopausal gal, when she gets on estrogen, I usually tell her, once dose is appropriate, give yourself 12 to 18 months, and your body will start to trust you again that, okay, you brought my estrogen back. I'm feeling good. And it almost just like it relaxes into itself. And I'll have gals who come back and they're like, you were right, Melissa. I lost 20 pounds. I didn't really change anything. It's just your body trusting itself again. So, but that's a tough when we're in the middle of it. And that's assuming everything else is dialed in. But I mean, when we see that weight just kind of tick up and you're like, okay, well, 5 pounds was one thing. I can't put on another 5, you know, and it feels like it's stacking. You have to trust the process a little bit too.
Okay. Oh, can
And
I ask one?
yeah, go ahead.
There's blood draws, but how do you feel? I've been doing also the 24-hour urine. Do you feel the 24-hour urine test is also just as adequate as to like doing a blood draw?
I'm going to loosely say they're all better than doing nothing.
Okay.
And I'll usually say be consistent with what you're using.
Okay.
My only take, like, I know Dutch is a big one. The urine metabolites, you get a ton of metabolites that you don't necessarily need, if that makes any sense.
Little.
Oh my
But,
gosh.
like when I get the breakdown of
much.
7 estrogens, it's like, okay, well, I always
Well,
kind
I
of
have a doctor look over it. I can't.
Correct.
No
But
way.
like from a medical perspective, I'll think about it like, okay, so great, I got these 7 estrogen metabolites. Well, if I'm only manipulating estradiol, do I need to know what these other 7 are?
Okay.
Is there even any part of that that's in my control to change?
Okay.
So I kind of tend to think about it in a practical way. Not that it's not all great information. I'll just tell you, be consistent with what you've been using.
Okay. Well, yeah, I've been
And
doing
track
blood
it that
draws
way.
mostly, and I'm going to do a urine draw soon to just get back just
Yep.
every 2 months, just to see where I'm at. I know I haven't started testosterone yet, and that's something that I'm also like, wait, shouldn't we be doing that too? So
Yeah,
this has
I
been
love it.
very helpful. Thank you.
Love it.
So much, Jilly. Really appreciate it. I think one of the things I love about you, Melissa, and you guys you'll see why, because when we talk about blood work, she's not selling one thing. And I think that has been the most massive disrespect, honestly, to women, for us to not have choices, for us to be able to trust ourselves and like which one. We're all trying to decide which one's the best one, which one's the real one. They all work. They all tell you where you're at. There might be ones that tell you a little bit more or a little bit less, but like Melissa said, something is better than nothing. So I just love it.
Just like when people ask that question about, well, which form of hormone is the best? The one that you're comfortable with and the one that works for you. That's the one. Just because pellets worked for your friend doesn't mean they're going to work for you. Just because your doctor said, no, don't do this, doesn't mean it's not an unsafe option for you either. You've got to explore what you're comfortable with. And my other caveat to every woman on here is, if you try a form of hormone replacement and it, quote, doesn't work for you or have side effects, don't give up. There are other options that might be your option.
Yeah. One of the comments I get a lot is that, oh, I tried HRT and it didn't work for me.
Same.
Women think that HRT is one thing. They think that it's some magical box that they're looking for someone to like give them. This is your HRT. And what we're learning through this experience is that we are more individual than we have ever been treated. Like your own body is its own thing. And even when research comes out, Your body was not in the research. Your
Right.
body was not. And that's why it's so important to be part of this conversation, where we're not just trying to tell you the education. We're also trying to remind you, you have to listen to your body. We can give you all the buy now buttons in the world, and you have to listen to your body. This is about trusting yourself, coming back to yourself, falling in love with yourself. And like Melissa said, giving yourself enough time to let your body be like, oh, she's taking care of me now. Okay, we trust this. We have to get back to that. We have to trust ourselves more than the buy now button. Okay, we're jumping back in. Libby, you're up. You ready?
Can you hear me?
We sure can.
welcome.
Okay. So just have a number of questions. I'm 66 and a half and have never been on any form of HRT. Been through years of just all sorts of, the cardiologist, the orthopedic, all the doctors that I know now. If I'd been on HRT, I would not have all these crazy trips to the emergency room because I thought I was having a heart attack and being diagnosed as osteoarthritis, which I do not have. But I'm finding it next to impossible to have anyone that would even talk to me about HRT. Last time I went to see my GYN and I asked her about testosterone, she kind of gulped and she said, "That's a male hormone." And I just was like, get me off this table.
I'm done.
I couldn't believe it. I do take vaginal estrogen, which is been a lifesaver.
A godsend.
Unbelievable. Anybody who's not on it, be on it. Everybody, every single woman should be on it.
I love it.
So on 100 milligrams of progesterone for hot flashes at night. I've had the bloating issues. I have, instead of taking orally, I've been taking it vaginally. That seems to help a little bit. I do find that when I don't take it, my joints start to ache again, just crazy. But how do I find someone, and I'm more than 10 years out of that window, to even talk to me about it?
This is a super one. Hi, Libby. Welcome to Joy. Let us wrap you in a big hug and say welcome. So that's going to be my first stop. And just so everybody knows, like you'll hear, we're probably all on Instagram, we're all on TikTok. The information is all over the place. Your most, and I'm going to use this loosely, beneficial time to start hormone replacement is in the first 5 years following from menopause to those 5 years. What I mean, that's when the greatest cardio and bone protection happens. Now, Libby's telling me she's 10 years out plus and still having hot flashes and night sweats. That doesn't mean that there's not still symptomatic benefit to go on estrogen post that time frame. Like you should be able to comfortably have intercourse if you're sexually active, whether that's with a systemic form of estrogen, with a vaginal estrogen, a combo of both. And absolutely, yes, testosterone is a male hormone. Guess what? It's also a female hormone. I'm going to guess not many of you even had a clue that in your, I'm going to use prime years, you actually had more testosterone comparatively than estrogen in your body. That ratio sits a little closer to 60-40, which is, again, it's so not well known for us gals that we think, oh, it's a guy hormone. Well, that doesn't mean that we don't have it as females. It is and can be perfectly safe in females. It's a natural hormone that your body is and should be making on its own. So
Libby, to answer your question directly, so this is why I do what I do. So wakeherup.co is the directory to find hormone therapists that have been recommended by women. Every single one of those doctors does prescribe testosterone because we make sure that they do. But Joy Women's Wellness is one of the top, it is the top telehealth provider.
Companies.
And they also will prescribe testosterone. One of the benefits in working with a telehealth provider, and everyone that's on this call, this is all for you, but try to understand that if you find a local hormone therapist, that doctor is limited to that one doctor's information and that one doctor's education. If you find a great local hormone therapist, you have found a needle in the haystack and you are luckier. And it is so insanely rare, but you are still limited to that one doctor. If you use a telehealth company, they are contracted with a lot of different providers that are all over the country. And because of that, they're getting more information faster than anyone else. And they are trying to win, right, the race against all the other telehealth, which makes them more incentivized to have the best options more than your one local doctor. Now, I go to a local provider. I love my local provider, but I also go to Joy because there are things that my local provider does not know, does not do, and I don't want to have to educate her on that. I'll just go somewhere that they are educated. So I give you that because sometimes we don't give as much weight to telehealth. We want to like walk into an office, but in the scope of things, telehealth actually has much more range than your local provider. So that's why we have Joy Women Wellness posting this this event. So
And
does
I
that
look at it as
answer
a
your question, Libby? Sorry.
Well,
you're good.
sort of. I'm just curious. It's not specifically about testosterone. It's also about, you know, the potential for an estrogen patch. And
Right.
Yeah, yes.
I also have osteoporosis, which I've seen a study that women, they choose women 67 to 72 years old. They had on a 0.25 estrogen patch, and their bone density numbers increased, even though
Without
they
question.
on HRT.
Correct. I don't disagree with you at all. I think there's some potential that is estrogen the factor? Do we need to go up on progesterone? Do we need to have a little conversation about testosterone? There's a ton of different avenues, but you know, without knowing medical history, to answer the high level of your question of yes, I absolutely think if you're still having those symptoms, and even from a preventative standpoint, yes, get on a systemic form of estrogen as long as it's appropriate for you. And the other thing I'll kind of feed on what Marcella said here is I love to collaborate. So the great thing is when you're in a telehealth or in a, whether that's a local practice or you're in a telehealth, you're going to get 5 different women potentially who can lay eyes on you and give an input. And so maybe Susie says X, and then 3 months later you see Emily, and Emily says, well, hey, what if we add this in? And before you know it, it's almost like wake her up, but from a practitioner standpoint, where you've got this team of women who are constantly moving the needle to help you be your best.
Yeah. And Joy works so closely with our community that it is just kind of this wild health team for women over, 40. And you're able to be part of the community and say, what are you guys doing? Or I got my, my estrogen's at this level, but I still feel like this. Like, what are you guys? It's just this whole community. So combined with having a provider that's working with you on all fronts and a community of women that can give you ideas on how to shift things around that maybe your doctor can't. We can say, play with it. Your doctor might not be able to be like, just play around with it.
Right.
So, but those two combined are kind of this magic that we've created. So hopefully you'll be able to, get on the directory, find someone there that fits for you, and or call Joy, and then also join in the community. And I think you'll find this like well-rounded like whole approach of what you're looking for. Okay, we're going to move on. We have got quite a few more questions. So I'm going to go to Jen Brown. Are you ready?
Hey there. Yeah. Hi. Thank
Hi,
you.
welcome.
Hi, Jen.
Hi. So I can't sleep no matter what I do. I'm 51. I think I'm fully in menopause. It's hard to tell because when I change progesterone type, sometimes I get enough bleeding that it seems like a period, but I don't think it is. I can't tolerate bioidentical. I was on a Dottie patch 0.5, now 0.075. And I was on medroxyprogesterone. It made me lose a ton of hair. Now I'm on norethindrone, however you say it.
Yep.
I have every supplement, like melatonin is like, does nothing, magnesium glycinate, valerian root, GABA, like a dozen others. And I can fall asleep pretty easily, but I wake up at 3 o'clock in the morning and can't do anything to stop it. It might be cortisol. I don't know. Like,
So this is going to be a super loaded one. There's a lot there to unpack. Like if you stop progesterone and bleeding, I would be doing a disservice if I didn't say, please have a transvaginal ultrasound to make sure there's no reason for the bleeding.
it
when
was
you
just
say-
upon switching, which I was,
Okay.
but yeah, okay, understood.
Just when you say you couldn't tolerate bioidentical, what do you mean? Explain that to me.
Depression, debilitating depression.
Oral estrogen, what were we talking about?
Progesterone was it was,
Okay, so you're talking about the progesterone piece of that.
yeah. Sorry if I
Okay.
said estrogen.
No, you're good. No, I just wanted to make sure that I was clear with you too. You're right. Cortisol is the hormone that's going to spike roughly between 2 and 4 in the morning. So that can definitely play a piece into it. But my mind goes to a million other different places too. Testosterone, huge, great from a sleep standpoint. Are there other forms of estrogen we need to look at? Do you need to break your progesterone up? Sometimes I'll have gals who will do a progesterone at bedtime and at dinner time. Maybe you need a sustained release progesterone. Maybe there's some oxytocin that can help you sleep. This becomes a huge, big bundle that we can talk through from that perspective. I just actually had a conversation with a gal yesterday who, again, we've been fine tuning for about 90 days. And she's like, I have not, finally, after 90 days, was like, I have never slept so good in my life. So you've been through the supplements, you've tried all those things, which tells me it's a deeper level of something that requires some layering back to figure out what is it. Like I'll raise my hand. Now I'm fortunate. I say fortunate enough. I'm going to use that loosely. I've had the partial hysterectomy. I'm on estrogen. I don't have to be on progesterone. I still do progesterone, but I'm a gal who can't tolerate a lot of progesterone. My max progesterone dosing is like 12.5 to 50 milligrams. 50's pushing it for me. And I'm someone who, if I take it 5 days in a row, or call it 6 days in a row, by that day 6, I'm crabbier and I'm having to self-manage, like put myself in the corner, like, let me try not to spout off at the kids. So and that's why I say there's so much more there to kind of unpack and talk through. Maybe you need a lower dose of progesterone split. Maybe we need to try a different formulation of progesterone. The other thing I will tell all my gals, so everybody on here listening, same thing, where if somebody offers you estrogen without progesterone, if somebody offers you medroxyprogesterone, I'm going to push hard back to tell them no. So I hate talking about the Women's Health Initiative because it's where most of my 50 plus generation, and even myself in my 40s, where we were told hormone replacement is bad, run away from it. It causes heart attacks, strokes, blah, 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 which we now know has been debunked, but is just now starting to get picked up by the Today Show and all of our big media strains. One arm that they are firm on of the Women's Health Initiative that they think is problematic was the synthetic arm of medroxyprogesterone. So I tend to like a micronized progesterone, a compounded progesterone, or the norethindrone that you're talking about too. So that's just, again, that's me doing my service to females. Hey, if somebody offers you medroxyprogesterone, I would lean pretty hard away against it.
And I'm done with it because again,
Yep.
it made a ton of hair fall out, which
Yep.
can I ask you a follow-up question to something you said?
Yes.
Okay, so my free testosterone is at a 14, which I know is low, but I'm ultra sensitive to any medication I've ever taken, and including this.
Yep.
I'm afraid that if I take any testosterone, it's going to make my hair fall out.
So a lot of times we can see the opposite. So because testosterone is a natural anti-inflammatory, I'll have a lot of gals when they start testosterone all of a sudden say, oh, my hair is looking much nicer than it was. Now, here's going to be my caveat because you're going to refer to the hair loss that can happen with testosterone. That is at a too high dosing for too long of an extended time period. And I'll kind of soft play you there too. If you're concerned, DHEA is a great place to start because it's a precursor to testosterone. It's where I started in my 30s. I finally about 38 said, okay, this is not cutting it anymore. I needed to make some changes, which is when I got on full testosterone replacement. But I'll have gals who do great on DHEA. So if you're a gal who's concerned, hey, how am I going to feel on testosterone? Start a DHEA.
Thank you.
Yeah,
Awesome.
absolutely.
I'm going to throw in the awakening part of this thing because Jen, I don't know if this is going to make sense to you or if this will feel right for you, but it's just a choice. It's just an option to maybe consider. I know a woman that wakes up at 3 a.m. almost every night, and she's decided that that is her like angel hour. And she writes in her journal and she comes up with the most fantastic things at 3 a.m. And then she can go back to sleep. Again, no idea if that speaks to you, but sometimes we decide things that our bodies are doing are wrong instead of getting curious. Like, I wonder why you're waking up at 3 a.m. Maybe you do have some things to say to yourself. Maybe there is something different to be done rather than just shut it off. And I just throw that out there just for like fun, for curiosity, that maybe you're not supposed to fix it totally exactly the way you think you should. Maybe it's something different. So just throwing that out there because I think it's kind of fun to play with like what our bodies are trying to do and not try to fit them into this exact right box. So there's that.
Well, and we've overused this sleep like a baby. Like we're not meant to go to bed at 8 o'clock and sleep all the way till 8 o'clock. Like if you look at circadian rhythms, in the ancestral days, you went to bed when it got dark and you got up when the sun came up. That's that whole follow your circadian rhythm, get yourself into a good frame there. Well, but what everybody forgets to mention is in the ancestral days, typically around midnight or so, somewhere in a ballpark there, they would wake up and be awake for 2 hours and have full on conversations and spend time with the family and then go back to get to bed for a while. You're supposed to be awake as you come in and out of sleep cycles. And I know when I kind of read that and educated myself further from that standpoint, I was like, oh, I can let myself off the hook when I'm awake at 2 o'clock in the morning. It's just, is this the night where I can go back to sleep? Because I think we look at the clock and we're like, oh, again? Gosh. And then we get mad and then we've stirred ourselves up enough that it's like, well, now I'm never going back to bed. I might as well just get up. Give yourself the grace. One of my favorite lines. Like,
it's kind of fun to think like, maybe maybe it's not wrong. Maybe
right.
I'm doing something at 3 a.m. I mean,
correct.
Right? Like it's just a little different than shaming yourself. Like, what is wrong with me? It's just,
right.
It just gives you some more like, more choices, more options.
Different perspective.
Yeah. Okay, we've got Donna and Claire. We're gonna try to bust through some of these conversations. So Donna, you're up. Can you jump in and ask your question?
Sure. So I, around 40, I had an ablation. And in 2019, I had breast cancer. And when I was done with my treatment, they tested my hormones because they wanted to see if I was pre or post since I wasn't getting periods.
Yep.
They said I was nowhere near menopause and I was, I guess, 50 at the time, which was strange. I'm 56 now, so I want to say the past year and a half, every possible symptom right now, it's probably at an all-time high. I have done nothing. My PCP put me on antidepressants, anti-anxiety, Ambien to help me sleep because I don't sleep.
Yep.
So being that I had breast cancer, so I went to my GYN maybe a year or so ago, and she asked me if I was taking hormones, and I had told her I always thought you can't really do that because I had breast cancer. And she kind of agreed. So I really kind of suffered through it. And now, you know, after gaining 20 pounds, I did the trizepatide, lost 30 pounds, which was great.
Awesome.
But the rest, everything else, debilitating
Still
depression,
stands.
anxiety. And I never had anxiety before. And I know it runs in my family, but it's just been horrible. And I know I need to see somebody, but I'm sort of like trying to educate myself because,
Yep.
you know, so.
So my first response is estrogen itself, progesterone itself, do not cause breast cancer.
Okay, because I had estrogen dependent breast cancer. I don't know if
Yep.
that.
So what that tells you and me is your breast cancer fed off of estrogen, but just because your body made estrogen doesn't mean it created that breast cancer, that tumor itself. So you are correct. In a gal who has had an estrogen and or progesterone receptor positive breast cancer, we tend to avoid systemic estrogen, but that doesn't mean that you can't do a vaginal estrogen. And then my favorite here is it doesn't mean you can't be on testosterone, which supports a little bit of estrogen in gals. So I'll have gals who go on testosterone and they're like, oh, my hot flashes are gone. I didn't think that was related at all. So, but I also am going to encourage you, do you still see the oncologist?
Just for twice a year for my mammo and MRI. That's it.
So have an in-depth conversation with them. Hey, what is my risk based on how far I'm out? I've had a couple post breast cancer gals who have made the choice, and that was a choice of theirs, where they kind of signed a waiver and said, I know what my risk is, but I want to go on estrogen because of how I feel. I don't want to age myself because of the lack of estrogen. And they were 10 plus years out from their breast cancer and just said, you know, okay, this is not worth how I feel. My caveat to all that is, and that's not me telling you, hey, go this way, go that way. At least explore some vaginal estrogen and have a conversation about some testosterone. And that's always a great place to start, because a lot of times if the energy is up and the hot flashes are down, yes, I may still have a little bit of dry skin and I may have some estrogen symptoms, but I generally feel better, which makes the rest of it more tolerable if I'm not able to go on it.
Okay.
Does that make sense?
Yes, it does. Thank you.
Just as a side note, my friend battled breast cancer for the last 10 years and stage 4, but over the last few years of her life, her doctor did give her testosterone, and I'm gonna cry, but like it allowed her to live like really, you know, without pain and have sex, and it really changed the quality of her life. So it wasn't going to save her, but it also wasn't going to make things worse, but it did give her quality of life. So testosterone is something that breast cancer people can be using. Okay, great question, Donna. I hope that this is helpful to you. Okay, we're going to jump in. We are at 11:01. We're going to go we're going to keep going. We got a little more time. So we're going to take a few more questions and we will wrap this up. Okay, Claire, you have been waiting so patiently. Thank you for being here. Jump on in. Oh, you're muted. Hold on.
I know my mouse is far
there
away.
you are.
I could use the space bar, but my mouse is really far from the button there. Yeah, and so I'm trying to figure out how to prioritize my questions. So one thing I am finally, yeah, I'm not using Joy yet, but it sounds like you could, yeah, I like your idea maybe of using it as an adjunct to the other physician I'm seeing. It sounds like if you sign up with Joy, you're getting multiple medical opinions. Is that what I'm hearing? That's really interesting.
So we've got a vast group of providers.
But I mean, you don't just see one at a time, or
we do.
So yeah, you'll see, yes.
Switch and yeah.
So correct. Yes,
try
you'll
to have
see.
you do one, but sometimes I think Marcella was saying sometimes if you don't like one, you could switch or whatnot. They do have licenses in certain states, so it depends on where you live.
Correct.
But they also do collaborate, and you know, there's a chat where they ask questions and say this patient, you know, has this. What are your thoughts? That kind of thing. Sorry to jump.
That's the collaboration that I was talking about. Thanks, Katie.
Okay. Yeah. And a couple things. So for one thing, so I am seeing an in-person doctor, not even in my state, but and I'm going to take my baseline labs pretty soon for systemic. Does it matter what time of day I take them? More first thing in the morning or afternoon?
So that's going to depend on what they're drawing.
Oh, okay. It's the estradiol, the testosterone, the progesterone, the FSH and SHBG. I think that's everything.
Okay. So here's what I'll tell you. As long as there aren't fasting labs, then generally no. You're
Okay.
going to get your purists who are going to tell you, yes, you should take it first thing in the morning before 10 a.m. because that's when like testosterone levels are going to be at their highest just due to a natural circadian rhythm.
Yeah.
You'll find people who say the best time is the week before your menstrual cycle. But at the end of the day, I'm still, again, I tend to practice what I call practical medicine. Take your labs when it's convenient for you to take your labs, as long as there's not a fasting panel in there. Like
Yeah,
if
okay,
Tuesday at 2 is what works for you, great. Then Tuesday at 2 is what works for you.
Okay. Yeah. The other thing about joy. Two things I'll try to make them quick. Joy, I found it interesting because like I looked, of course I've looked at all Joy and all the competitors of Joy, and interesting that like I haven't found, I mean, maybe I just didn't find them, but it's interesting that you guys do have tea, which a lot of the others, MIDI and Alloy don't seem to do. And are you confident that long term you can keep prescribing testosterone?
So I can speak to that for a
How does it work?
second. I work with all these providers. The reason why you see people like Alloy and MIDI not prescribing tea typically, now I'm going to say typically because I've heard that sometimes they do, is because they claim that everything runs through insurance. And you have to remember that if you are running things through your insurance, you are blocked into what is allowed in your insurance. And so that is why MIDI and Alloy do not typically prescribe testosterone, because no insurance, like
Covers.
hardly none,
Yeah. You have to
covers.
convince them about your libido and yeah.
So you just have, and there are limits on like the estrogen patches. There's limits on progesterone. There's like, if you're in the system, you are in the system. And that's something you have to remember when you're going anywhere, because someone like Joy, they're out of the system. They're cash based, and that allows you to have much more range and much more say over your healthcare.
Right, more off-label uses and things like that. Okay.
Yep.
And sorry, one other thing about exercise from the beginning of our meeting.
Yeah.
So yeah, and I have had issues with, and I know what you mean about the not wanting to do weightlifting. Did it get that? Like I've always, so one of the other reasons I'm going to an in-person doctor is because of my pelvic pain issues, which instead of getting better with exercise, they get worse. Running, riding a bike on a rough road, things like that, or mountain bike or something like that, bumpy, like I'll get terrible, kind of like it feels like a hybrid of a menstrual cramp and a UTI. It's awful. And it's doubtful that it's endo. But anyway, but I need even without that, I still need to, as time passes, I need to do more weightlifting because of, losing muscle as you age, plus avoiding injury, things like that. Running always made me feel confident and great and endorphins. But like if I do a weightlifting session, I don't feel like anything. Like I don't feel good after. I just feel like I did a task. Did that change for you?
Honey, you're my new best friend. So when I had my hysterectomy, I asked my surgeon, and I'm like, okay, so talk to me about weightlifting. She was like, well, I really don't want you doing heavy squat. And told me kind of my parameters. And so what I heard was, oh, cool, I don't ever have to lift again. Yay me. I can run. I can just do the cardio I love. So there are times, yes, it still feels like a task to me to weightlift. It's finding, I guess for me, it's finding where is the joy. What part of weightlifting brings me joy? Putting plates on a squat rack and doing heavy squats feels like a task. Okay, how many reps do I have to do? So I would tell you, find the method that works best for you. I've currently, like for me personally, I've currently been doing Peloton body weight exercises at home. I'm looking into P-Volve, which is another big that's kind of geared towards perimenopausal women that is a loose resistance training, but using your body in lighter weights. So yes, we're always going to tell you lift heavy weights. You should have a heavyweight day, but not everybody has that capability. And your body is a heavyweight.
Right.
Move it.
Yeah.
Use those resistances. So, and so kind of my long way is, yes, as I have done more body weight type stuff, I'm like, oh, cool. Look at me. I just knocked out 50 push-ups in 30 minutes. Yay. Without being like, okay, it was row day, it was leg day, it was whatever day it was. So I would just tell you, number one, find the weightlifting that brings you some sort of joy. Try a bunch of things. My second thing is, please tell me, have you done any pelvic floor therapy?
Yes, I'm doing now.
Okay.
Yeah.
Perfect.
It was my pelvic PT that sent me to the urologist that I'm seeing now.
Okay.
So
good.
Yeah, so I'm still continuing to do that. And but and then so I'm doing the pelvic floor PT and just what was I gonna say? But for things like something like a push-up, even when I was much younger, like late 20s, I would try every day and I never got able to do it.
So do girl push-ups, do them on your knees. I don't know why we call them girl push-ups. I mean,
Right.
So I'll give you for example, there's a guy that I do a workout with on Peloton who at birth had an arm amputation, ripped, does all sorts of things for Peloton, but he doesn't make apologies for doing his push-ups on his knees.
Yeah.
Who cares?
Yeah. That's the thing that's frustrating. It's like, I don't feel like I'm getting stronger. Like when I could run before, it would give me pelvic pain. I would see, oh, now I can run for this long, or I can handle this hill I couldn't handle. Like I see progress.
Yep.
It's hard because like weightlifting, I don't know if I'm getting stronger or not.
I'm gonna do one of these testosterone.
Yeah. That's what I'm really hoping for. That's why I'm like hoping my labs are like, I'm hoping like, I was like, I actually booked my lab for 3 p.m. because I want it to be as low as it can be. And I've been tested for T before, even when I was like 29 or something, and by a dermatologist because I had some chin hair. And he told me even then I was low.
Yeah, it's only gotten lower, I can about guarantee.
Yeah, and he didn't tell me the number, but it was, so, but I'm like, I just want to make sure because I really hope I can try that because there's, and for a lot of the other brain benefits and things like that, I'm really hoping in the sense of motivation and confidence.
Sleep, anxiety, muscle tone, joint pain.
I'm 47 now, and at age 38, I noticed something where like my extroversion turned into
introversion.
Afraid of people and going out in public and feeling like I'm unwelcome everywhere. And I don't want to get too dark, but that like it happened, like something changed. And it's not just if I was depressed or anything before, the nature of it changed. Yeah.
Yeah. So
I want to invite you to if you're not already, be part of the Wake Her Up community on Facebook.
Yeah, I just joined it. I didn't know
Fantastic. About it. I think that's something that you're going to understand this is like all very normal, like you're doing it right. It's all age appropriate, right? Nothing's wrong. And the other thing too is with the working out, over the next couple months, we're going to do these little challenges. We hang out together, we talk about weightlifting, lots of different methods, lots of different ideas. And so it's in the creativity that people really find their answers and really starting to listen to yourself. There is no requirement for push-ups, right? Like none.
Right.
So
for example, I was like, I just don't know if I'm doing, I don't know if it's working, like.
Okay.
And if you're moving your body, it's working.
Thank you for your questions. We're going to take, we have 3 more hands up. I really would love to get to these. So I know that you probably have 100 questions. I'm going to pick on you. And if you can just quickly explain your one question, we're going to whittle it down to 1 and get through the next 3 people and we're going to close out. Okay. So Casey Maxwell, you want to jump in real quick here? Let's see if she is still here. Casey. Okay. She's not here. I have a hand up for Cindy. Cindy, are you still here? Do you want to ask your question? And then I have somebody that
Okay.
says,
Oh, there goes Cindy.
oh,
Can you
there we go.
can you hear me? Okay, sorry.
Yes.
So I just have a few questions.
Can you whittle it down to one question? We are tight
Okay.
on time. Sorry.
All right. So I just started testosterone and it put me up from 12 to 83 total, and then the 10.5 for the free. Is that, I'm just wondering if that's like, my husband's just really concerned because of all the studies of being too high, and I just don't know really where to find any studies to show him different.
There's me.
Do you
I'm
feel
at like 300.
right?
You're
Do
at
you feel
300?
better?
Oh yeah. I'll
Well,
look at this all day.
So studies
when
are
I took-
hard because there is no testosterone approved for females. Like everything is an
Uh-huh.
off-label use. Gosh, it was at this point, it's probably 15, 20 years ago. There was actually a study going to approve testosterone for females that they basically aborted. And this will make everybody super happy. They pivoted and ended up going down an ED route instead. So you're going to be hard pressed to find a normal optimal level from a study standpoint. Most of us in the field will loosely say 100 to 200 is quote optimal. Now, do I have gals who feel great at 350 with no side effects? Yes. Do I have gals who do better at 75? Yes. As a practitioner, like I know the signs I'm looking for if you're getting too high and how to pull it back. So your body's going to tell you, yes, I'm too high. So if you're growing a man beard, if your acne is out of control, increase in clitoral size, those are some of kind of your common side effects that you can see, voice changes, hair loss. Again, most of those are dose dependent and over an extended time period. So, and then on a lab standpoint, there are a couple things that we can watch for to make sure that testosterone levels aren't getting too high from that perspective too. Now, I'll get an acne lesion once or twice when I'm like, oh, my levels must be peaking. Okay, no big deal. Back down I go. I pluck the same 4 hairs that I have plucked before I was on testosterone. And you're never going to hear me about the slight increase in the size of my clitoris because orgasms are better than they've ever been in my entire life.
So, but what his concern is is that for cardiovascular, for like heart disease.
Oh my gosh. No, not at all.
Okay. All right.
So we know loosely in guys that the target range is a free to total ratio of 2%. Now the hard part is from a female perspective, because the studies haven't been done, we don't know if that's a target for females, but absolutely not. So here's what I tell everybody is from a testosterone standpoint, you are decreasing your risk of Alzheimer's disease. You are decreasing your risk of developing any and all types of cancers, and you are decreasing your what we call all-cause mortality, your risk of dying from anything.
Okay. All right. Thank
Now,
you.
I do have a follow-up question
Yeah.
to that because when you're taking injections for testosterone, does it thicken your blood? Is that
Yes.
possible?
Testosterone in any form can.
Right. Okay. So then would that increase your chances of possible stroke?
So the true answer there is going to be yes, but at an extremely high risk. So a good provider, like as a female, if you come to me and your hemoglobin is 16 and you're on testosterone, I'm going to tell you, hey, we're creeping up there. That risk really doesn't start to hit until we hit a hemoglobin closer to 20, 22. So most of us as practitioners have this kind of built-in fail-safe where we're like, hey, I'm going to watch this. You're creeping up a little bit. People who smoke and dehydration are also things that are going to affect that hemoglobin and hematocrit, which can increase it up. So a lot of times we'll do that method first to say, okay, are you hydrated? Are you a smoker? But the increase in the hemoglobin and hematocrit is my very first sign that dosing may potentially be too high, which is why I always recommend it being checked on a fairly regular basis.
Love it. Thank you. Okay, I have one person that it says iPhone 96, if you have a question still. And then I still have
Casey's back too. Yep. She was
Casey,
back.
would you like to ask your question?
Yes, can you hear me?
Yes.
Yes.
Oh, good. Sorry, my Zoom and I were fighting. Yes, my question is, I'm in the beginning of things. So I am just now starting to get informed. I'm 42. I have a feeling I've been in perimenopause for quite some time now and just didn't know. Thank God for TikTok, I guess. Unfortunately, my primary care physician, I haven't had a lot of support. I've talked to my doctors, my gynecologist. She put me on a low dose birth control, which I was kind of disappointed at how quickly and without much discussion that kind of happened. But I was desperate for pretty much anything because the hot flashes are a joy, and the whole sleeping thing, and basically a lot of the symptoms that you guys have been talking about. And you guys have covered a lot of ground, and I kind of got into this a little late. So my question is this: in the position that I'm currently in, is it best to just, I am going to look online for targeted like HRT positions and all that. Is it better right now to join Joy and kind of just straddle the two and go from there? I'm just I'm a little lost at just how to approach all of this because it's overwhelming. There's a lot of information and a lot of knowledge that I don't have. And I'm now understanding that testosterone is super important. You know, and estrogen supplementing, all that good stuff. So I'm just kind of a blanket start here would be great information.
I think if you haven't joined Wake Her Up,
that's on my list. Yeah.
Perfect. I ask in the group, hop on, because I know on the website you can type in your zip code and say, okay, who around me?
Right.
Ask within the group. But the easy answer is yes, of course. I mean, at Joy, we would love to be able to help you and guide you along this pathway. And like, I'm a realist, so I know, like, I don't expect every patient who comes through my door to be my best friend. Like, I know I'm not going to vibe with everybody. So number one, I'm just going to commend you for starting this journey for yourself and keep searching until you vibe with someone. If that's Joy, awesome. If that's if you're like, no, I like telehealth is great, but I need to sit face to face with somebody, then keep searching until you find someone.
Sometimes, and that's where I've found it, because things are different. Like I'm kind of in that weird like spot where I grew up, you go to the doctor. Now telehealth is becoming very prominent, which is great because it's more efficient. You're not waiting months and months.
Right.
Because I've realized that a lot of the things, like I went from basically no medication to I'm on an antidepressant. I'm on a Lexapro, generic. I'm now, ADHD things are starting to pop up. My husband and I laugh because, again, like I said, TikTok is hysterical, which, it's obviously frowned upon. You don't want to be like searching internet, like WebMDing things and all that, because that's always a slippery slope. But it's wonderful to target. You're like, wow, I identify with this. Okay, yeah, that checks a box. That checks a box. Holy crap, that checks. So it's been beneficial as far as just identifying symptoms and to find that it's probably mostly attributed to perimenopause and things like that. That's where it's been very interesting. So it's been interesting bringing in telehealth. So I'm trying to balance that. That's where, I was just curious on starting points, I guess.
Yep. I think one thing that's nice, Casey, is that because of the directory that we built, the Wake Her Up directory, one thing that's nice is before we were like piecing together our health system, and you still have to in some form, but when you go to one of these HRT providers, they know HRT. You're not like training
it's a specialist.
them, so now you have this group of 50,000 women that can kind of fill in some of these gaps and help you ask the right questions. And you have this big, massive view of like what's available. And then
it sounds like a wonderful resource.
Instead of training your doctor that knows nothing. You're able to be like, okay, I like this doctor for this, and I also need this, and they don't do that. So I'm going to go to this doctor for this. Like, you have choices and you know what to go find rather than trying to just go with your one doctor that knows nothing. So that question is so pertinent because we're so used to being like, this is where you go. And there isn't that anymore. And the Wake Her Up directory is kind of like the best thing available. It's just going to get better, but it's not perfect, but it is all of the hormone therapy providers that have been recommended by women. So it's a really great starting point. So come to wakeherup.co and you'll find everybody we love there. And it's a good place to start.
Well, and thank you for the resource, because it is very hard when you're dealing with a physician. And I'll be done. I know we're on a time crunch. I'm my old gynecologist. I asked her, I said, you know, I'm dealing with depression. I'm dealing with these things. Is it possibly a hormone imbalance? And she literally looked at me and said, are your periods regular? And I said, yeah. She goes, you're fine.
And you're fine.
You're a tired mom. You're a tired wife. You're a tired working woman.
I'm like, really? Okay. Yeah, no, she's no longer my doctor. But it's when you're young too, it's intimidating because these are the professionals. So
we thought wrong. We
so
it's
very nice. What you guys are doing are wonderful. So
thank you so much. I'm so glad you're here. I hope that's helpful. Okay, one last question. We're gonna wrap this up, and we gotta keep this quick. I'm so sorry, my friend. I don't know your name, but iPhone 96, you have your hand up, and Hi. Okay.
So sorry, I couldn't figure out how to unmute it. I really appreciate you guys. Thank you so much. I'm 35. I'm post-surgical menopausal, whatever you want to call it. And for a year and a half, they've been sending me to every, specialist imaginable, trying to find like lymphoma and, giving me all kinds of different reasons for things other than that it's menopause that's causing my symptoms and my blood work to be abnormal and all that stuff. And then just recently, I finally got somebody to prescribe me estrogen methyltestosterone. And then shortly afterwards, my endocrinologist discontinued it. And I've been just begging for testosterone in any form, gel, cream, whatever it is that they can prescribe. And everyone just, all of my symptoms are just like, this has nothing to do with hormones, but the relief that I got from that little bit of testosterone was huge. At the same time, they refused to give me progesterone. I know I don't have a uterus, but for my symptoms, I was just asking if I can try it. And then my estrogen, with being on 2.25 milligrams of estrogen, is still at a 12. So I was just wondering if you have any guidance. Well, obviously after this whole, video, I'm, looking forward to join Joy, because it's been a nightmare trying to find somebody to help me or listen to me. Yeah. But I was curious if there's anything as far as like estrogen to why it wouldn't be. I was on the patch and I realized it wasn't working, and I'd asked for blood work to be done and they said no, and I asked to change forms, but even with changing to oral, it's still at 12.
So I loosely won't worry about the number itself. Like if you say, hey, I don't have any vaginal dryness, my hair feels great, I'm not having hot flashes, night sweats, then I'm not going to care about the level near as much. Okay. But if you're still experiencing symptoms, then yes, let's keep trying different forms. Maybe you need a higher dose. And this is the hard part. I tell this with everybody. Nobody in their prime said, you know what, I feel really great. I should go get a hormone panel and see what my levels look like. So when I'm dumpster fire in 10 years, I know what felt good to me.
Right.
Nobody does that.
Right.
We wish we had. When we're in the thick of it, we're like, God, 10 years ago, it sure would have been great if I'd had those labs. But to that point, yes, maybe you're not absorbing. Maybe there's some gut issues that for some reason that you're not absorbing the oral estrogen. Maybe you need a rapid dissolve. Maybe a cream would do better for you. But again, if you're on that 2.25 and you say, honestly, my symptoms feel pretty good, maybe your body's trying to tell you that there's something else missing. Maybe it is that testosterone support that you need, that your body's trying to shuttle it elsewhere.
I don't feel any better at 1 to 2.25, but the testosterone gave me
made a big difference.
First difference that I felt this whole entire time, which was just like mind blowing. So I'm like, Yeah, I'm so frustrated because, you know, I mean, yes, oncology care is one thing, but then it comes to hormones and you're told like, yeah, I'm going to be your specialist and I'm going to give you everything you need. And all of a
Right.
sudden you're gaslit to, this is not hormonal and there's nothing wrong with you. And I'll send you to a psychiatrist and a therapist and a neurologist and a endocrinologist and a rheumatologist and a hematologist. And I'm just like, I just want testosterone because I just want to feel better.
Yep. Well, and I'm going to get a little emotional on this piece here, but I feel like I need to apologize for every woman because the system we're in is broken. I had to do all my own education. What we got in medical school was very minimal, but yes, you'll hear things like the menopause, and there are people out here and we're trying to change the narrative. But the hard part is we can't even agree. Like
Okay.
I've been gaslit for doing pellets, for being a cash provider. It's like we need to get everybody in a room and duke it out, but can't we just all support that we're on the same mission to support women, and that there are those of us out here who are trying to do it in a safe, healthy way? And it's as much as a practitioner letting your ego go to say, you know what, my education wasn't great on that. And encourage our patients to say, go find someone else who can, and teach me what you learn along the way.
Yeah.
You have to advocate for you.
Do you need to have your, like, because I already, you know, I have my testosterone level, it was low and everything, but then, you know, I tried on a different telehealth platform and it's been like months and they're like still like, oh, go for more blood work. And I'm like, I already have the level here, like it's very clear that it was low, like can you just help me?
I'll
And
let
they're like,
Katie
well,
answer that one better,
yeah.
or kind of reach out to Joy as an offline and say, here's my labs, here's how recent they've been.
Yeah,
And we can kind of take that from
We're
there.
happy to use your labs, and for testosterone, our providers do want to see a lab, but if you have them, you can just send them to us and we can prescribe off of that. I mean, we go off of symptoms, but for testosterone, since it's a controlled substance, they definitely like to see those labs. But I'll give you my email and I'll put it in the chat, and I'm happy to help you any way I can.
Thank you. I appreciate it. Thank you so much, you guys. Thank you.
Thank
This
you.
group's here wrapping you in a hug.
Thank you. I
There's hope.
appreciate it a lot. Thank you.
Of course.
All right, we are going to wrap this up. This has been everything I hoped it would be. I hope that you all feel the same. I think that I'm going to get emotional because this is the kind of care we deserve.
Right.
And gosh,
Don't
my
start.
hormones must be working right because I can feel feelings, right? And I want to end everything that we talked about is linked in the chat. And if you register for this, you're going to get a follow us email. Hopefully the recording went well. You're going to get this to be able to watch again. We'll also be including all of the links that we talked about in an email to you. I want to end with, please remember that no matter what, whether you figure out your hormones and you end up in this beautiful exact right spot or not, this is a phase that ends. This is a phase that all women will go through, and you will get to the other side. Just like my 10-year-old, she's in this weird little body right now that's a little bit fluffy, and she's just there. That it's being 10. She hasn't started her period yet. She's nervous about it. Everybody's weird. Friendships are weird. Everything's weird. We're just weird. Here we are. We're in our weird spot. And I think if we start to embrace that, get creative, make it funny, be okay waking up 3 a.m. I don't know. I don't know what you need to do, but this is a phase. And we have been taught, our whole society has been taught to shut it down, to not be weird, and don't be emotional, and you should sleep 8 hours a day and all these things. What if they were wrong? What if we are doing it exactly right? What if we're supposed to just be losing our minds? What if we're supposed to forget shit because we just want to forget things? What if we don't need to worry about all that stuff? And that's why our brain forgets things. I don't know. But have some grace with yourself. Embrace your little puberty new 45-year-old, right? Like, love her. She deserves your love. She deserves your listening. And I hope that if nothing else over the next year, 2 years, just today, that you will recognize her and you'll start listening to her and know that it matters that you feel good. It matters that you pay attention. It matters that you invest in yourself, that you spend the time with yourself, because in the end, what we're really all looking for is to be seen, to be loved, and to know that we're enough. And until you see yourself and love yourself, you will not have any of that. So it's time for women to wake up. Hormones dramatically help. That's why we had this conversation. But in the end, see yourself and love yourself. And I really want to help build a world where women feel awake and alive. And people like Katie from Joy and Dr. Melissa Loseke are here to help us do that. And all of you, it matters that you're here. It matters that you exist. You waking up your soul makes the world I live in and raise my daughters in a brighter place, because there's one more woman living awake and alive. So thank you for being here. Thank you on behalf of me and my mom and the women that I love. It matters that you exist. So thank you for paying attention enough to be here, and click register and spend an hour with us to awaken your soul, because this is how we change the world. You're doing it, and it matters. So thank you so much for everything you've done. Please, please, please click on the link, register for Joy. There are discounts. You can use the code Marcella for $40 off of your blood work. You can also use the code Wake Her Up for 10% off everything else. If you want a free introduction to my book, Wake Her Up, you can go to marcellahill.com and get a free intro to my book, Wake Her Up. That's for your soul. That's like the little last second that I just jumped in here. If you want a little bit more of that, that's free for you, marcellahill.com. And then please, please join the Wake Her Up community, because those women, they got you. You have found your people. We got you. You are not doing this alone. So come hang out with us over there. Is there anything I've missed? That's kind of it. I wish I had music that you could play you and just roll you out of here. But next time, come hang out with us. I'll figure out the music and we'll dance our asses off all together. Thank you for being here. You guys are lovely. Have a wonderful Friday and a beautiful weekend. Thank you, Dr. Melissa Loseke, for being here.
Always.
Thank you, Katie, for hosting this and putting us together. Let's do it again.
Thank you. Bye, guys.
Bye, everybody.